Yes, good. So first try to use the swab, so which is very much essential to clean the entire ear. To clean the entire ear, you just clean it. Give me one tune so that you can understand. So you all know the ear is made up of the cartilage. Ear is made up of the cartilage. I uses step by step. So there is a systematic protocol. First, what points we should use on the ear? That point to be known as a sympathetic point. Which point? This point to be known as a sympathetic point. I just inserted the one point, that is sympathetic point. Where exactly this point is located? There is a triangular fossa. There is a triangular fossa. In that, on the lower portion of the triangular fossa, we just activate this particular point to bring down the calmness, and also this works as a autonomic nervous system, sympathetic and parasympathetic nervous system to be taken place. This is the one point we just inserted. So the second point to be known as a Shen Men. First one is a sympathetic point. Second point to be known as a Shen Men. So Shen Men is a great point to treat for the numerous diseases, to calm down the central nervous system, and also anything related to the
you are away from the mic, sir. We can't hear.
Withdrawal symptoms. If they causes any kind of the withdrawal pain or withdrawal symptoms or the puking sensation or some kind of the irritation within them, so that will calm down the thalamus, especially the Shen Men point. You know Shen Men. Shen means is a spirit. Men means is the door. That means is the heaven door or the spirit door or the God's door. So which is located on the triangular fossa on the superior margin. Now you come to the third point to be known as a kidneys. The third point to be known as a kidney. You just apply the 1 point kidney. So this kidney will be really helpful to regulate the overall health, which is connected to the anything the phobia. Because of the phobia or the loneliness or some kind of the stress and mania, they take the drugs addiction, that also to be regulated. Then the fifth point to be known as a liver point. I just activate the another point to be known as a liver point, but liver point also good to regulate the detoxification for anything, because you all know the people who consume either it is the alcohol or nicotine or any unwanted substances or drugs, or these drugs will going to accumulate on which organ? Liver. Hepatic organ. So therefore the liver detoxification is very much important. There you just apply the liver point. Since in the liver system there is no mother point and son point or grandmother or something like that, you just activate the liver area of that region. That will take care of the regulation of the liver system. The last point, but definitely is the great point, that point to be known as a pulmonary system point, that point to be known as a lung point. You just apply the one more point, this point to be known as a lung point. So one lung point, or you wanted to use the 2 lungs point also advisable, or you can wind up with the 5 points are quite enough to eradicate from the root level. But this is not my procedure. The people who are using this globally, they are using for the number of the countries to eradicate this. But rather than eradication and the treatment, but prevention is very much essential, and to bring the awareness about the how the people are using like a less salt and then less sugar. So that program to be taken place. Even I wanted to announce you that very soon, but after completion I'll give the announcement. But this is eradication. Before that, awareness is required, which I told you: alcohol plus liver, alcohol plus cancer, alcohol plus pancreas, alcohol plus heart. How the heart get impacted? In the similar way, most of the times we require the awareness to the common people, so that they will come to know that reality, because many people, they don't have that awareness. Yes, my father had, I'm using, and my parents had, or my ancestors are using, or my friends are drinking, I wanted to drink. But everybody doesn't have all the knowledges, but that knowledge is very much essential. If the government of India is taking care of this kind of the plans to bring the awareness for the global level, I think that would be really good. But by the way, by using these points in the span of short period, you remember, at least 10 to 15 sittings we can complete this procedure, and with that the patient's consent, patient's intention. So definitely we'll make them that this is the good and do's and don'ts, this is the pros and cons, what happen after taking this, do the small counseling. Otherwise the counseling centers also existing, or the psychiatrics, without taking medicines, how with the counseling the patient can be withdrawn these symptoms, that also good. Otherwise, with the patient's counseling, along with that, you can do this NADA protocol, that will be really help to treat and eradicate this from the root level. Thank you.